皆様、おはようございます。こんにちは。
Good morning, ladies and gentlemen, or good evening, or good afternoon. And we'd like to begin the joint WHO and Ministry of Health, Labor and Welfare Japan side event, creating tipping point for transforming food environment to achieve sodium reduction.
I'm the unit head of Safe, Healthy, and Sustainable Diet Unit of the Department of Nutrition and Food Safety in WHO. WHO is very delighted to organize this special side event of the Tokyo Nutrition for Growth Summit, jointly with the Ministry of Health, Labor, and Welfare of the Government of Japan on this very important topic of sodium reduction for the global public health. And I am very honored to serve as the overall moderator of this special side event. Now, I am very happy to introduce Dr. Naoko Yamamoto, our Assistant Director General for the Division of UHC Healthier Populations in WHO, to deliver the opening remarks. Dr. Yamamoto.
Thank you, Chizuru-san. Dear Excellency, dear colleagues and friends, good morning, good afternoon, good evening. Globally, cardiovascular diseases are the leading cause of death. In 2019, an estimated 17.9 million people died from the cardiovascular diseases, representing 32% of all global deaths. About 3 million of those deaths can be attributed diet high salt, mainly via raised blood pressure. Yet, people around the world are consuming much more sodium than necessary. In fact, much more than the current WHO recommendation on sodium consumption for adults, which is 2 grams of sodium per day, equivalent to 5 grams of salt per day. Over 2/3 of the world population exceeds 7 grams per day, and in some countries, average consumption levels are high as 15 grams per day. Reduction sodium intake in the population is feasible. Some countries have achieved the reduction with comprehensive action on offer and demand of food. Suggested measures include reducing sodium content in processed food, reducing the availability of foods high in salt, or reducing the marketing food high in salt, and encouraging people to choose the option containing less salt. These measures lead to the reduction in sodium consumption with immediate and important impact of blood pressure and NCDs. Promoting a health diet critically important now more than ever as the world continuing to face the COVID-19 pandemic. Health diet can help support body immune system, fight infections, and protect against all forms of malnutrition and NCDs. We face an enormous challenge, but we also have an enormous opportunity to improve the health and well-being of people all over the world. The Tokyo Nutrition Growth Summit is a great opportunity for countries to renew their commitment to transform the global health food systems and promote safe and healthy diet for all. I would like to thank you, Minister of Health, Labor and Welfare and Government of Japan for their partnership and leadership. The Ministry has been championing the tech actions in sodium reduction and joining us our efforts to improve global food environment to promote healthy diet. Today, we will hear about the various country experiences, including Japan, and different innovative actions. I hope these experiences will inspire countries and national government, particularly those that have not yet started or still considering commitments to accelerate action in reducing population sodium intake. I look forward to our continued work, and together we can make progress to transform global food environment to achieve sodium reduction and achieve healthier population. So looking forward to discuss with you about these important issues. I thank you. Back to Chizuru-san.
Thank you very much, ADG, for setting the scene. Now, I would like to introduce Dr. Yasuyuki Sahara, Director General of the Health Bureau at the Ministry of Health, Labor, and Welfare of Japan, who unfortunately is not able to be with us in person, but he will join us through the video message. Thank you.
Konnichiwa.
Hello, everyone. I'm Yasuyuki Sahara, Director General of Health Bureau, Ministry of Health, Labor, and Welfare of Japan. I'd like to thank you for participating in joint WHO and MHLW Japan N4G side event titled Creating Tipping Point for Transforming Good Environment to Achieve Sodium Reduction. On the occasion of the opening of the event, I'd like to say a few words of welcome. It is known that excessive intake of sodium increases the risk of onset and aggravation of disease such as cardiovascular disease and non-communicable diseases. As for NCDs, in the United States Sustainable Development Goals, reducing premature mortality from NCDs through prevention and treatment is recommended. In order to achieve SDGs, sodium reduction is a global and pressing nutrition challenge. Under such circumstances, it gives me a great pleasure to jointly organize this event under the leadership of WHO today. Japan has a long history of tackling with sodium reduction. For example, in the 1970s, Japan was successful in drastically reducing strokes. Even so, excessive intake of sodium is one of public health challenges of Japan. I heard Japan is not alone. Other countries in Asia are also facing similar situations. What is important for reducing sodium is to implement measures best fit for actual situation of each country and region. By sharing experiences, I believe we can make a progress. Japan has taken various measures in this area, and today, from a graduate school of Kagawa Nutrition University, Professor Yukari Takemi will talk about recent activities. I sincerely hope today's session will serve as a tipping point for achieve sodium reduction in the world and help accelerate implementation of countermeasure for NCDs. Thank you for your attention.
Thank you very much, Dr. Sahara. Now, moving on with the agenda of the side event, and I would like to introduce Dr. Ryan Yamamoto, the scientist at the Safe, Healthy, and Sustainable Diet Unit in the Department of Nutrition and Food Safety in WHO. She will present briefly the overview of WHO's work related to sodium reduction. Dr. Yamamoto, you have the floor.
Thank you very much, Dr. Nishida. So I'd like to begin with the background of WHO work on sodium reduction. Can I have yes, thank you. Next slide, please. So on the left-hand side of the slide, you can see our scientific advice work dates back to 1980s. And since then, there have been multiple efforts to review and update the recommendation. Fast forward to 2012, WHO issued the recommendation to limit sodium intake to less than 2 grams per day or 5 grams salt in adults. This WHO scientific work translated into the political commitments, which you can see on the right-hand side of the slide. Most importantly, in 2004, the adoption of the WHO Global Strategy, followed by 2013 Global Action Plan for the Prevention and Control of NCDs. Also, in the Codex Guideline on Nutrition Labeling, sodium was added as a mandatory nutrient to be declared among other nutrients. With this background, I would like to talk about what WHO has been doing in the space of sodium reduction. Next slide, please. Okay, so let's first begin with the WHO Global Sodium Benchmarks, which we published this past May. Let me put the link to this document in the chat so that everyone can have the document in front of you. Just a second. All right. So next slide, please. So the WHO Global Sodium Benchmarks are the maximum limit or the upper limit for the amount of sodium that can be contained in processed food products. And they provide a harmonized global goal. And this is important because even the same processed food products often contain varying amounts of sodium in different countries. So it's crucial to eliminate this regional disparity so that all countries can equally benefit from foods with lower sodium. Third, global sodium benchmarks serves as a guide for countries. We understand that different countries have different local food environments, food cultures. Also, countries are at different policy stages. So countries can adapt the global benchmarks to facilitate the implementation according to their own situation. Fourth, the global benchmarks serves as a basis for dialogue with industry. WHO needs industry to implement the global sodium benchmarks to reformulate their products to contain less salt. Finally, the global benchmarks were established for 64 food categories, which are commonly consumed processed foods. Next slide, please. So here are the 64 food categories for which we established global sodium benchmarks. So we have bread, cheese, processed meat products. These tend to be major contributors to salt intake in many countries, and et cetera, et cetera. You can get the full list in the document I just shared in the chat. Next slide, please. Let me just mention very briefly how we established the global benchmarks. We held a series of technical consultation and expert meetings virtually over the course of several months up till March this year. We invited experts, government officials, and WHO colleagues from regions and countries from all over the world who actually set up their national or regional targets. Next slide, please. So we can say that the global benchmarks are built on the technical work and experiences of the member states and WHO regional offices, which already have set their own targets. So in principle, the lowest value for each subcategory from existing national or regional targets was chosen as the global benchmark. Because they are the lowest of the existing national or regional targets, the global benchmarks are designed to be challenging enough to drive the progress. However, we learned from the country's experiences that it is feasible to reduce sodium levels in processed foods through setting national targets. We believe these targets can be implemented in other countries as well, and that would enable all countries to equally benefit from foods lower in food. Next slide, please. So I'd like to show you here that the global benchmarks are really based on various countries and regions' targets. You can see on the right column different names of countries from which the global benchmarks were derived. And these are just several examples out of 60 or so subcategories in total. You can find the full list in the document. Next slide, please. So in summary, WHO expects countries to adopt the global sodium benchmarks to reduce their population sodium intake. And we expect industry to implement the global sodium benchmarks. And WHO also expects civil society and consumers to advocate and demand for lower sodium processed foods. Okay, thank you. Next slide, please. So now moving on to the second topic, which is guideline development on the use of low sodium salt substitutes. As a background, unfortunately, many countries are struggling to meet the global target to reduce the population sodium intake. Therefore, the low sodium salt substitute emerged as a potential strategy to reduce sodium intake, especially in countries where the majority of sodium intake come from discretionary use. For example, salt added during cooking or at the table. However, because many salt substitutes replace sodium chloride with potassium chloride, there are concerns over potential adverse effects, such as hyperkalemia, which happens when you have too much potassium in your blood, and this can cause a serious medical problem. This is of particular concern for people with chronic kidney disease or people who are on medications that impair potassium excretion. So WHO decided to embark on the development of guidance on the use of low sodium salt substitute. Next slide, please. Briefly, when developing guidelines, WHO uses an approach called GRADE for evaluating the quality of evidence and strength of recommendations. This is, in fact, the approach used by the Cochrane as well. So following this GRADE approach, we conducted a scoping review, a systematic review, as well as a review on contextual factors. Our nutrient expert group called NUGAG, so Nutrition Guidance Expert Advisory Group, has initiated discussion in December 2019. And right now, as we speak, we're in the process of finalizing the discussion and formulating recommendations through a series of meetings over the past few weeks. We're hoping to publish the final WHO guidelines sometime early next year. Next slide, please. Now moving to the third item. In January 2021, WHO launched an action framework for developing and implementing public food procurement and service policies for a healthy diet. We believe governments have a unique opportunity and responsibility to lead by example by implementing healthy public food procurement policies, requiring that all food and beverages served or sold in public settings contribute to healthy diets. This action framework provides an overview of how to develop, implement, monitor, and evaluate a healthy public food procurement policy. Next slide, please. Finally, very quickly, I'd like to also introduce you to resources relating to sodium reduction. One is this shake package. So this package outlines the policies and interventions which have proven to be effective in reducing population salt intake. And it also provides country case studies for the recommended interventions. Next slide, please. And this is my last slide. The second resource is the Sodium Country Scorecard, which is housed in our nutrition policy database called GINA. This scorecard tracks countries' progress in policy towards sodium reduction based on the information we receive from countries and partners. Okay, so that's it from me. Thank you very much. And hand back over to you, Chizuru.
Thank you very much, Ryan-san, for the succinct overview. I know it was very difficult to present the huge scope and the broad range of the work related to sodium reduction, which WHO undertakes and implements, not only at the global level, but also at the regional and country levels in such short time allowed. So the focus was more on the work being carried out at the global level, but please note that this does not negate many of the important work being carried out by our colleagues at both the regional and country levels. Now, we would like to hear the accelerated actions being taken in Japan, which has a long history of implementing actions to reduce sodium intake, as also, Dr. Sahara also mentioned in his opening. I am very delighted to introduce Professor Yukari Takemi from Kagawa Nutrition University. She is the chair of the Committee on the Promotion of a Healthy and Sustainable Food Environment of the Ministry of Health, Labor, and Welfare in Japan. And she will tell us some new initiative to implement innovative actions through public, private, academic partnerships. Sounds very curious. So Professor Takemi, the floor is yours.
Thank you very much, Dr. Nishida. I'm Yukari Takemi, professor of Kagawa Nutrition University. It's my great pleasure to talk about Japanese experience for salt reduction. I chaired the Committee on the Promotion of a Healthy and Sustainable Food Environment by Ministry of Health and Labor and Welfare. Next, please. This is outline of my presentation. First, I'll talk about efforts to reduce salt in Japan up to now, and then I'll talk about the new initiatives through public-private academic partnership in Japan. Next, please. This figure shows a recent salt reduction in Japan. You know, Japan has long been the country with high salt intake. Now, average salt intake per capita is still 10.1 grams. The purple line shows the target of the National Health Promotion Plan called Health Japan 21, that is 8 grams. It's almost impossible to achieve this target. We have significant challenges with salt intake. The salt reduction initiatives are categorized continuum from upstream to downstream. In general, upstream interventions achieve larger improvement in population rather than downstream intervention. Most of Japanese activity have been carried out in downstream schemes. We have implemented various consumer awareness campaign and intervention in settings, intervention in community worksite and schools. For labeling, nutritional labeling of processed foods has become mandatory since 2020. In Japan, not sodium, but declaration of salt equivalent is mandatory because we have implemented consumer education and intervention that I mentioned with use of salt equivalent. So Japanese people from children to adults will understand the meaning of salt equivalent. Lastly, I talk about food reformulation. Food reformulation is recognized effective for salt reduction. In Japan, we don't have any mandatory reformulation scheme, but we have a lot of examples of voluntary reformulation by the food industry. I will show you some examples later. The important thing in deciding the effective scheme, effective strategy, is to assess the salt intake sources. This figure shows salt intake sources of Japanese adults. About half and more came from pink parts, which shows self-cooking at home. The last came from ready-made foods and dining out. This situation is a little bit different from Western countries, I think. One of the characteristics of Japanese diet is that we still cook at home and eat. Therefore, we need both of two actions, nutrition education and improving food environment. These figures shows salt intake sources in detail. About 60% of salt intake came from seasonings, such as soy sauce, salt, and miso. Miso is soybean paste. For effective salt reduction for Japanese, reducing sodium in seasonings is critical. Now, I show you some Now I show you some examples for food environment action through the collaboration between the industry and academia. The Japanese Society of Hypertension, JSH, accredit reduced salt products since 2012. Many food companies are responding to this accreditation. A lot of reduced salt products with good taste is very important, are actively developed by food industry. Voluntarily, you can find many items in the pictures, seasonings, processed fish products, and pickled vegetables, and noodles, and snacks, so on. The figure on the right shows the sales amount. Sales amounts of these accredited salt reduction products increases more and more. Currently, the market is 45 billion yen. This is another example. The new certification system for healthy meal and food environment was started in 2018. This certification system is for food retailers, restaurants, and worksite cafeteria, which continually provide well-balanced meals, of course, reduced salt meals. We named well-balanced meal as Smart Meal, which was selected by open recruitment. We developed a certification criteria for Smart Meal based on the dietary reference index for Japanese and other scientific evidence. The consortium, consisting of 13 academic bodies related to NCDs, including Japanese Society of Hypertension, judge and certify the retailers. Look at the figure. Look at the figure on the right side. Now, 536 retailers were certified all over Japan. Blue parts show worksite cafeteria. Yellow parts show takeout meal, bento, obento in Japanese. Red parts show dining out. In Japan, 90% of companies are small and medium-sized. Small and medium-sized companies don't have own cafeteria. So takeout bento is much needed, essential for working people in Japan. We conducted a non-randomized control trial in a medium-sized company using the Smart Meal bento. After 1 year intervention, a significant decrease in salt intake was observed in intervention site. From now, I'll talk about new initiatives. Based on the progress of the efforts mentioned so far, Japan will start a new step for creating a healthy food environment. Ministry of Health, MHLW, convened a committee to discuss how multi-sector collaboration among private sector, academia, and the government can effectively promote a healthy and sustainable food environment. Members in the committee included representatives of private sectors, media, civil society, consumer organization, and academia. The figure on the right side show the framework of nutrition and dietary area of the National Health Promotion Plan, Health Japan 21 first phase, which was started in 2000. From that time, in Japan, food environment is understood and treated as including not only food access, but also information access. And food, the word food. Food means all forms of food item, dish, and meal. We cook food item for dish and meal. The basic concept of new initiative is to encourage business sector to provide healthier food products, which consumers, regardless of their level of health consciousness, can choose and purchase at affordable prices. In promoting this initiative, not only the nutritional aspects, but also the environmental aspects are important. This initiative follows the global trend by supporting healthy eating, which can also contribute to the achievement of the SDGs. The priority nutrition issue for this initiative is salt reduction. This figure shows a framework of the new initiative. Each stakeholder is expected to engage actively. For business sectors, is expected to develop and mainstream healthier, low salt, and environmentally friendly products, and also expected is expected to support a behavior change by providing appropriate information for consumers. For consumers, is expected to increase the use of those products, those items. For role of government, the government will develop an overall program and coordinate among stakeholders. This initiative will be launched just now in the fiscal year 2021 by MHLW, with the participation of the business sectors on a voluntary basis. As I mentioned, most of Japanese companies have engaged in salt reduction efforts voluntarily, so we decided to make the new initiative fully based on these achievements. But there are some new points. We require business sector to set their own action targets of salt reduction and indicators to monitor their progress. The action targets and the monitoring process will be published, which will help improve ESG, environmental, social, and corporate governance evaluation, and expand opportunities for business. Conclusion. Globally, it has been well recognized that it is important to promote a healthy and sustainable food environments. The Japanese Salt Reduction Initiative follows this trend. This initiative is expected to last until 2030, along with the SDGs, through public-private academia collaboration under the coordination of the government. Thank you very much. That's all. Thank you for your attention.
Shizuru, we cannot hear you. You're on mute.
Thank you. Sorry. Thank you very much, Professor Takemi. The new initiative of the ministry, which covers quite extensive area and continues to identify sodium and salt reduction as a priority nutrition issues. It is enlightening to know that the initiative will take into consideration not only to create healthy food environment, but also to now enhance the sustainability of food environment. Another interesting point was that the close engagement of different stakeholders in this new initiative. And in particular, I was sort of, my eyes were caught with this statement that the business sectors interested in participating in this new initiative are required to set their own action targets and indicators to monitor their own progress, which will then be published for transparency. So it will be interesting to see that we are very, very interested in see how that will work out. Let us now look at other country experiences. The first, we would like to hear from Brazil, which has been taking progressive actions in promoting healthy diet. I am very happy to introduce Dr. Eduardo Nilson, Deputy Coordinator of the Food and Nutrition Division at the Ministry of Health in Brazil. It is in the middle of the night in Brazil at present. So it has been a tremendous effort and a commitment for Dr. Nilson to join us at this event in person. So we sincerely thank you for your support and being with us. Dr. Nilson, now over to you.
Eduardo, you're on mute.
Oh, sorry. Thank you, Shizuru, and thank WHO and the government of Japan for the opportunity of being here and sharing the experience of Brazil, but also learning from other countries. Next slide, please. I'll start by speaking about a little background from Brazil, showing the burden of disease in Brazil and the burden of dietary risk factors, especially sodium, which is the major dietary factor that we have in Brazil, and knowing the actual burden. So we have over 30,000 deaths from cardiovascular disease that are attributable to excessive sodium intake, but also a huge burden in terms of direct and indirect costs to the economy, but also to the health system of Brazil. Next, please. And also it's important to acknowledge how much sodium we consume, how much salt. So as it's spoken by Japan, we consume too much sodium as well. And we consume almost twice the recommendation of WHO. And we have a common pattern in terms of dietary sources. So we have a major contribution of the table salt and salt-based condiments, but an increasing participation of industrialized foods, processed and ultra-processed foods, but also other foods. Next, please. So that leads us to a need to accompany the trends in terms of dietary patterns, but also building a multi-component strategy. And here we see the increasing participation of processed and ultra-processed foods at the same time that we're consuming less and less foods at home, which used to be a tradition in Brazil, and it's represented by a reduction in terms of the use of table salt and salt-based condiments over time. So we have to tackle both of these situations. Next, please. And here are some of the actions of these multi-component strategies, starting by the reformulation of foods, healthy public food procurement policies, improvement nutritional labeling, and behavior change communication and mass media campaigns. So we try to join both upstream and downstream strategies in order to tackle all of the food categories and dietary sources. Next, please. And starting by communication, with most of our communication is based on the dietary guidelines from the Brazilian population, which is food-based. So we have a very important focus on dietary patterns, improving diets through prioritizing fresh and minimally processed foods, but also ensuring that people use small amounts of culinary ingredients, which include salt, and using that to bring message to the population, but also to health professionals. And more recently, we have launched dietary guidelines for children as well, so we can also help the development of taste for children and healthy diets from the very beginning. And our challenge is actually to improve that through communication over time and to bring this message constantly to the population. Next, please. And here are some of the messages that we have in terms of salt, the risks of too much salt in the diet, but also alternatives to reduce salt to the population. Next, please. And food labeling has been a major concern. But we have, since 2003, we have mandatory sodium declaration in foods, and also health claims regarding low sodium foods. And more recently, we have approved a scheme for front of pack labeling, which enforces foods that are high in food, high in saturated fats and added sugars, so the population can have a better translation of the nutritional profiles of foods. And for the future, we have as a challenge to assess the main impact of these these schemes, but also to expand that to, for example, to restaurants and other food services. Next, please. And speaking of food services, we have to address also how manipulators use. So we've been addressing that through good nutritional practices for bakeries, improving some, trying to give sales to some local initiatives, and challenges to make that scalable, and also to expand the targets to restaurant foods, fast foods, traditional artisanal foods, so we have all foods encompassed by targets. Next, please. And speaking of procurement policies, our main example is this National School Feeding Program, which has nutritional profile. It is very strict in terms of sodium content, but also addresses the dietary patterns, and especially food purchases from local farmers. And it's very important for us to expand regulatory policy, especially in terms of restricting the sales and marketing of unhealthy foods in schools, both private and public. Next, please. And finally, I'll speak of food reformulation, which is on a voluntary basis with an umbrella association, which reaches 70% of the market in Brazil. And we have set maximum sodium content in foods and prioritize foods that most contribute to sodium content, and working that as a gradual situation over time, a gradual progress, and with transparent criteria and monitoring. And it's very important for us to have the benchmarks as set by WHO and also by PAHO in the region of the Americas, so we can have benchmarks to relate to and to improve our work over time. Next, please. And here are some examples of the progress that we have made. On the left, we see the percentage of reduction of the average content of sodium in foods from 2011 to 2017. But on the table on the right side, we can see that based on the original PAHO targets, we still have space to improve. And so we, in relation to the most stringent targets in the Americas, we still need to move forward in terms of these categories, and also to include new categories to be targeted over time. Next, please. And here are some of the results of the impacts that we already found. There is a huge reduction of sodium used by the industries, but it's very important for us to have the health outcomes. And firstly, we have been studying the impacts of comparing voluntary targets to mandatory targets, and also including the benchmarks that we have mentioned. So we can see that the national targets are able to reduce sodium consumption, salt consumption, I mean, by 0.20 to 149 grams per day. But we know that applying more stringent targets and the lowest targets in the world will be able to achieve much more reduction. So regarding what we have at the moment, we have already a huge impact in terms of both CVD cases and deaths with the voluntary targets. Next, please. But we know that in the future, we need to move forward and strengthen the other strategies. So here we have from mandatory targets, the front of pack labeling, media campaigns, and the use of low sodium salts, the possible impact that we will have. So we can actually improve that and actually add one to the other as part of this multi-component strategy. Next, please. And to finish my presentation, I'll speak that the key steps that we have found for our success as continuously reducing food. So you can't do it at once. You have to have multiple strategies. Transparent and impactful policies are very important, especially in terms of monitoring and evaluation and criteria. And having the use of national data extensively, we can build and strengthen the tailor-made strategies for the country. Next, please. And finally, what we can do more is to continually adjust the targets, include more food categories, increase the enforcement and reach of the reformulation targets, not only to industrialized foods, but also to restaurants and other foods. So creating these targets, and finally, continuing to model the impact so we can have the most effective strategies, and especially to enforce in terms of fiscal and regulatory policies that may be needed in the future. Thank you very much.
Thank you very much, Eduardo. The Brazil's experience highlighted the importance of implementing multiple strategies to address all dietary sodium sources, and also the need for monitoring and continuously adjusting the sodium targets to ensure the effectiveness of food reformulation. And that was a very important point. It was also encouraging to hear that you are now considering sodium targets for restaurants and other food the service operators, with a view to improve out-of-home food environment, which many of the countries have started to look into because of the increasing utilization of the out-of-home the food service operators. Now we would like to move to Sri Lanka. I am very pleased to introduce Dr. Vindya Kumarapeli, is the Director of Non-Communicable Diseases at the Ministry of Health in Sri Lanka. And Dr. Vindya has been engaged in sodium reduction work for a number of years and has been instrumental in critical actions taken to reduce sodium intake in Sri Lanka. Dr. Vindya, the floor is yours.
Thank you very much. Good day to all of you. and thank you very much for giving this opportunity to present the implementation of salt reduction policies in Sri Lanka. Next slide, please. So the National Salt Reduction Strategy of Sri Lanka 2018-2022 was developed in line with the National NCD policy of Sri Lanka, which was published in 2009, and the shared technical package of the WHO. Several rounds of consultations were held with health and non-health stakeholders to adopt these strategies. In addition, in 2019, new regulatory provisions were added onto the Food Act of Sri Lanka, dated 1980. Next slide, please. So I will briefly describe the key policy directives implemented in Sri Lanka in terms of adopting standards for labeling and marketing, supporting settings to promote healthy eating, and promotion of reformulation of food to contain less salt, along with the challenges we have faced. Next slide, please. So the first directive was the front of pack labeling regulation. This regulation was gazetted by the government of Sri Lanka in 2019 for packaged and processed food to indicate the salt, sugar, and fat levels using a traffic light color coding system. A grace period of 6 months was granted before the gazette was fully enacted, and consequently, the Ministry of Health advocated the food industry on this new regulation. In collaboration with the WHO, a label survey of over 4,000 food items was conducted after the first 6 months of gazetting to assess the compliance of the industry and also to be used in an evaluation of effectiveness of this regulation in future. Only 1/4 of the food items we surveyed had labels that were in accordance with this new regulation. Ministry of Health also designed and conducted 2 mass media campaigns, again with the support of WHO, one on importance of reducing dietary salt, mainly targeting the mainstream media, and another using social media on the interpretation of food labels to make healthy choices when purchasing packaged food. However, the industry appealed to the Ministry of Health to extend the grace period to implement the regulation and also to change the cutoff level of salt, sugar, and fat used for this color coding. However, only the grace period was extended based on this request, not the cutoff level. In addition, the main challenge was monitoring the implementation of this regulation, which was affected due to the COVID-19 pandemic. The color codes are planned to be used to guide food items to be allowed at hospital and school canteens. Next slide, please. So the second directive was to promote healthy eating in settings of schools and hospitals. A landscape assessment was conducted in 2020 by the Ministry of Health in collaboration with WHO on food procurement and provision in hospitals and schools in Sri Lanka. Based on the findings, guidelines to promote healthy eating in hospitals and schools were developed. However, it's noteworthy that state sector handles over 90% of the total patient admissions and outpatient visits to hospitals. And most schools in Sri Lanka are maintained by the government as part of our free education policy. So for hospitals, guidance was given for menus for diet in terms of low salt, sugar, and fat served to inward patients, and also for the canteens within hospital premises, which serve the patients and the visitors. The guidelines also contained a framework to monitor its implementation. Approval of the advisory board of NCD of the Ministry of Health was obtained to implement this guideline in state hospitals. And we have already shared the guideline among large private hospitals in our country. And this guideline will be submitted to the Ministry of Education for implementation through canteens in state sector schools. However, the implementation was delayed as the hospital services were reprioritized to cater to the COVID pandemic, and the schools were closed since the onset of the pandemic. However, we expect that this guideline will promote a healthy food environment in hospital and schools in our country. So third one was a stepwise approach. Next slide, please. So thirdly, a stepwise approach was adopted to engage with the food industry to reduce the salt content of commonly consumed food through reformulation. An advocacy meeting was held in 2020 with key chain restaurants on the proposed voluntary process. This was followed by a lab analysis of salt level in mostly sold 250 items of food in these restaurants. Based on the results, food items to be reformulated to contain less salt were selected. The targets for salt levels in bread were set with timelines, and this was supported by advocacy and training material to initiate the process. Next slide, please. As mentioned by previous speakers also, in Sri Lanka also, we mostly consume home-cooked food, but the pattern is changing now and rapidly. Bread is the mostly consumed out-of-home produced food item in Sri Lanka with a mean salt level of 1.43 grams per 100 grams. And therefore, a standard weight of a loaf of bread, which is 450 grams, would contain 6.4 grams of salt. If a person consumes half a loaf, 3.2 grams of salt is consumed, which is more than 50% of the WHO recommended upper limit of 5 grams per person per day. So the reformulation instructions propose a voluntary target of maximum 0.36 grams per 100 grams salt in bread, which is close to the global target as mentioned earlier, which is 0.33 per 100 grams. So our proposed voluntary target is a 75% reduction in salt in bread from the present level while adding 36% potassium chloride, and this is to be achieved in a stepwise manner over a period of 1 year. So the main challenges are the targets being voluntary and reaching the numerous small-scale bakeries for our advocacy and training programs. And finally, we plan to award a health certificate to bakeries that comply with the recommendation as a reward. Next slide. Thank you very much for giving this opportunity to Ministry of Health Sri Lanka. Over.
Thank you very much, Dr. Vindya. Sri Lanka is also implementing multiple the strategies and policy actions to address all dietary sodium sources, including front-of-back labeling and food procurement policies. We were also very delighted to learn that the Sri Lanka has adopted the WHO Global Sodium Benchmarks for setting up the target for bread, which is the most consumed out-of-home produced food commodity we understand. Although Dr. Vindya also highlighted some of the challenges that they are facing, but we are very, very delighted to hear this news. Thank you. So now we would like to move to the United Kingdom. I am very pleased to introduce Dr. Alison Tedstone, Deputy Director, Diet, Obesity, and Physical Activity, and she's a Chief Nutritionist of the Office of the Health Improvement and the Disparities in the Department of Health and Social Care in United Kingdom. Dr. Tedstone is known by many of us as she has been behind many of the policy actions which have been implemented successfully in the United Kingdom to reduce sodium intake, as well as to reduce sugars intake, among others. Alison, now the floor is yours.
Thank you very much, Chizuru. It's a pleasure to be here and to be talking about sodium. Could my slides be shared, please? Thank you. Could I have the next slide, please? So in the UK, we have been working on sodium reduction for many years, indeed, I haven't given a sodium talk for quite a long time because our sodium program is very well established. Our program goes back over 12 years, and it stemmed from advice from our independent scientific advisory committee on nutrition to reduce sodium intakes to a maximum of 6 grams per day. And that was based on the scientific assessment of the relationship between sodium intake and hypertension, and therefore the risk. And as hypertension is an established risk factor for for stroke and heart attacks, we were able to quantify the risk of high sodium intake to our healthcare system and to quantify the lives saved that could be achieved through sodium reduction. Because we were the first country, I think, in the world to have a comprehensive policy of sodium reduction, we set about having conversations with industry that they were not familiar with. So that was a challenge, but I can say after all these years that it has been successful. So overall, we have seen our sodium intakes are now around 8 grams per day in the UK. Our salt intakes, rather, are around 8 grams per day in the UK. And that is measured through urinary sodium measurement. So it is a robust measure of intake, and some countries, because they use dietary intake, may report different numbers, but we know this represents the actual. We have had waves of sodium targets set for the food industry that have been ever lowered. We have had many categories of foods that these apply to. It is a voluntary sodium reduction program, but on the whole, we've had quite good buy-in from industry and a high degree of commitment. The categories apply to retailers, own brand products, to manufacturers' products, and to products produced by the out-of-home sector, restaurants, cafes, fast food chains, and so on. The targets for the out-of-home sector are higher than for retailers and manufacturers, and that was the case because they were slower in being embraced within this program. You will see in this slide that we have brought the targets down for foods in a number of waves, and published the most recent sodium targets just before the pandemic. We do intensive monitoring in the UK, so we monitor what's going on in foods and also what's going on in terms of sodium production, consumption. So can we move to the next slide? These are examples of the progress that has been made in the last time we published an assessment. And you can see that there has been quite a high degree of compliance with the voluntary program, and really very surprising, and it really represents a very good buy-in from industry on this, and a high level of commitment from them. And can I have the next slide, please? And Our next set of targets are to be achieved by industry by 2024. And at that point, we will monitor again how industry are doing and look to decide the next steps on the programme. Moving on to the next slide, please. Now, in the UK, we've supported sodium reduction through consumer campaigning. So we've had, since at the start of the programme, we had a lot of TV campaigning on sodium reduction, encouraging people to take responsibility for the amount of salt they are adding to the food, but also to read the label. So about 75% of sodium in the UK diet comes from within your food, not what you add to food. So the industrial component of this is incredibly important. So we have had underpinning legislation. So we've had other things going on to support this as well. So we've had legislation that controls the advertising of foods to children. And that's during children's TV programming, and what foods that can be advertised are controlled by a nutrient profile that includes sodium within the profile. So high sodium foods cannot be advertised during that time period. We now have legislation to extend the advertising controls away from just children's TV programming to include family TV up to 9 o'clock in the evening, and also comprehensive controls across the internet, again based on a nutrient profile, so that will restrict high sodium advertising. We have voluntary front of pack labelling, and of course, because we were part of Europe, have mandatory nutrition labelling, including a sodium declaration on the back of pack. We have high take-up of front of pack traffic light labelling, which includes sodium, and lower in sodium claims are regulated. We have public buying standards for food. So people who work in government offices have some controls on the number of high sodium foods that can be sold, and importantly, as an earlier speaker has mentioned, we have mandated standards, so legislative standards for the food that is provided for children within schools, and that includes strict sodium standards. So if I can have my final slide. So as I've mentioned, the next important thing happening for us in terms of sodium is the introduction of legislation to further control advertising, and, which I haven't mentioned, to control price and place-based promotion of foods in supermarkets and real supermarkets and online supermarkets. So that is again based on the nutrient profile, and it will limit things like buy one, get one free for high sodium foods, and also place-based promotion. So that's things like end of aisle and checkout promotion. Salty snacks will not be able to be placed in premium locations within the supermarket to drive sales. One thing that I should mention is, which I hadn't thought to include about this, but there are a number of obesity strategies which include a portion size calorie reduction program. And of course, because the amount of sodium you consume is not only dependent on the amount per 100 grams of product, but the volume of food, those obesity reduction strategies are important also to support sodium reduction. So thank you very much for the opportunity of letting me speak here, thank you. Back to you, Chizuru.
Thank you very much, Alison. The United Kingdom has also been taking a long but very steady journey towards reducing the population sodium intake. And the results have been very impressive. But the journey continues, as we just heard from Alison. As it was highlighted in all other countries' presentations so far, a challenge remains in the United Kingdom, also in the need to improve out-of-home food environment, as a number of people who are eating out increases more and more. The need to improve out-of-home food environment was also highlighted during the COVID-19 pandemic, as in all countries, out-of-home food consumption, whether as take-home or ordering for delivery, have increased tremendously during the pandemic. Now, I would like to introduce Dr. Robin Mckinnon, the Senior Advisor for Nutrition Policy at the U.S. Food and Drug Administration, Center for Food Safety and Applied Nutrition. Unfortunately, she was not able to join us in person, as it is also in the middle of the night in the United States at present. So she has kindly sent us her presentation in video recording, which will be played now. Thank you.
Hello, and thank you for the opportunity to join today to discuss the U.S. Food and Drug Administration's sodium reduction efforts. I'm Robin Mckinnon, I'm Senior Advisor for Nutrition Policy at FDA Center for Food Safety and Applied Nutrition. On average, people in the U.S. vastly exceed recommended limits for daily sodium intake at all age levels. What you see here is our population by age and sex, and the percentage shown in orange of each group exceeds recommended sodium limits. So even our youngest children exceed these recommended limits, and this can have a profound impact on health outcomes. As many are aware, excess sodium intake increases risk for hypertension and cardiovascular disease. Over 100 million U.S. adults have hypertension or high blood pressure. And in 2019, 800,000 Americans died from cardiovascular disease. And the economic costs of heart disease alone are enormous. We know that many consumers wish to reduce their sodium intake, but it's challenging for them to do that with our current food supply. Over 70% of the sodium we consume in the United States is already in the packaged and prepared foods, not added at home via the salt shaker or in cooking. We know that some food manufacturers have started reducing sodium in their products, and we certainly applaud those efforts. But more needs to be done to improve public health. We know that there can be a wide variation in sodium levels within food product categories. For example, in top-selling brands of bread, it can range from 300 to 700 milligrams of sodium per 100 grams of bread. So we know that reductions in packaged and prepared foods are possible. And here are some recent actions we've taken to help reduce sodium intake in the U.S. In 2020, we issued final guidance on the use of an alternate name for potassium chloride in food labeling, the use of the term potassium salt. Potassium chloride is a key tool in reducing sodium in food technology, can act as a partial substitute for sodium. And so if manufacturers use some potassium chloride as a substitute ingredient for sodium, this action may help facilitate consumers' choices to decrease their sodium consumption. Related to our sodium reduction targets, in 2016, we published draft short and long-term targets for reducing sodium across the food supply. We received several hundred comments, met with numerous stakeholders, and we carefully considered all of the comments that we received. And just recently in October, we issued final guidance on short-term, 2.5-year sodium reduction targets for processed, packaged, and prepared foods across food supply. And in preparing the targets, we considered other countries' experiences in reducing sodium, including Canada and the United Kingdom. Canada reports that their average sodium intake has fallen to less than 2,800 milligrams per day, although we know that there's variation across the population. And the United Kingdom has issued 5 iterations of their voluntary targets and reported reductions in sodium intake and improved public health outcomes. As of 2019, almost 100 countries have sodium reduction initiatives in place, many of which are voluntary sodium reduction targets for the food supply. And as mentioned, we issued our final voluntary short-term sodium reduction targets in October of this year. And this includes targets for 163 categories of processed, packaged, and prepared foods. And in developing those targets, we carefully considered the technical role of sodium in foods, like food safety, fermentation, color, flavor development. And this guidance applies to food manufacturers, to restaurants, and to food service operators. Overall, we recognize a broad, gradual effort is needed to reduce sodium across the food supply. This helps to create a level playing field for industry, and it also helps consumers' palates to adjust to lower sodium. And the targets aim to support decreasing the U.S. average sodium intake from approximately 3,400 milligrams to around 3,000 milligrams per day over the next 2.5 years. That's about a 12% reduction. And although those average intakes would still be above the recommended limits, even modest improvements across the population can produce large public health benefits, resulting in reduced morbidity, mortality, as well as cost savings. And going forward, we plan to monitor progress, engage with stakeholder groups, and then issue revised targets to further encourage sodium reduction through an iterative process. And in addition to the sodium targets, we at the US FDA are taking a multi-pronged approach in our effort to help reduce sodium intake. As mentioned, we've issued guidance on an alternate name for potassium chloride in food labeling. We're continuing efforts related to nutrition labeling on food packaging, and we've developed new consumer education materials as well. And also, as part of our menu or calorie labeling requirements for restaurants and other covered establishments, written nutrition information must be available upon request for standard menu items, and that information includes sodium information. So we're taking a number of steps. And in addition to that, we're working closely with our federal partners, including the CDC, the Centers for Disease Control and Prevention, the USDA, the US Department of Agriculture, and several other groups and federal partners on many nutrition-related efforts, including exploring new ways to coordinate, leverage, and amplify each other's nutrition and sodium reduction efforts. At the FDA, we are strongly committed to our mission to reduce the burden of chronic disease through improved nutrition, and our sodium reduction efforts are an important step in our broader efforts to address preventable diet-related chronic diseases and advance health equity through improved nutrition. Thank you again for the opportunity to join today. Wishing you all the best for a successful event. Thank you.
Thank you very much, Dr. McKinnon. As highlighted in the presentation, over 70% of sodium comes from outside of home food environment in the United States. As it was important, therefore it was important to set the targets for different food categories. And doing so, it was interesting to hear that they had reviewed sodium targets set by various other countries, as we have done in WHO when we developed the global, the WHO global sodium benchmarks. In October, they had issued the final short-term targets. They call it short-term targets, and are now working on setting up longer-term targets, which we understand would be more ambitious. So we are very much looking forward to learning more about the next step which the United States is taking. Now, I would like to introduce Mr. Steve Wern, the Director of Global Affairs at the Food Standard Agency in United Kingdom. He is the newly elected chair of the Codex Alimentarius Commission. So congratulations again on your election, Steve. I would like to hand over to you, Steve, for moderating the panel discussion. Now, over to you.
Thanks, Chizuru. And it's been great to hear the experiences shared by Brazil, Japan, Sri Lanka, UK, and the US on the development and implementation of their national sodium reduction strategies. And so I see the panelists have joined on the screen. And really the purpose of this moderated discussion is to provide a stimulus for those countries starting out in their programs. I'd like to start maybe with asking what created the momentum and tipping point for action in your country. Maybe turning first to Dr. Nilson, because you highlighted the healthcare costs and burdens of ill health in Brazil in your presentation. Did these create the momentum, or were there other ingredients before you got started? Over to you.
Thank you very much, Stephen. What was very key for us, not only in Brazil, but to many other countries, was the support by the Pan American Health Organization, because that's what actually broad experience from the UK, which was actually when we look to the UK as a role model in terms of what we applied to Brazil and tried to adapt, but also Australia, Canada, other countries that were developing in 2008. So we started by then, and then gathering information. That was very key for us to have the information on the burden, the food sources, so we can actually tailor the plan that we implemented in the country. So stressing the importance of the regional support, also of WHO through PAHO, which was key to not only to Brazil, but to many other countries.
Thanks, Eduardo. We heard also the Sri Lanka experience and the need to frame national salt reduction strategy within national policies for overall controls on non-communicable disease. Dr. Kumarapeli, is there anything you think in that sort of framing of overall non-communicable disease reduction that's helpful for those countries starting sodium reduction programs?
Yes, so in our country, actually, NCDs is a huge burden, and cardiovascular diseases and hypertension accounts for nearly 34% of the total annual deaths. So that was the main point that we considered, and also as highlighted by the other speakers, we have done several surveys on mean population salt consumption. So that was the eye-opener actually. Our consumption was more than double the recommendation, which was 11 grams per person per day. So that actually made us to focus more on this salt reduction and frame it into the overall national policy, and as well as to develop a specific salt reduction policy for our country.
Thank you. So we have the awareness of the burden of ill health. We have awareness of national sodium intakes. We have the importance of regional support. So thinking about the creation of a new program, what other ingredients are needed at the outset? And I want to open the floor now to Dr. Tedstone and Professor Takemi for any other insights they have to share. Who'd like to go first, Alison?
Shall I go first? Thank you, Steve. So I would say that political buy-in was incredibly important in the UK. Our food industry is very big and it's very powerful. So having the political buy-in is really important. And of course, the science to get that was critical. Another element would be civil society, the NGOs, and they are very powerful and became very well organized in recognizing that if we wanted to see improvements in non-communicable disease, we could just, it didn't work just to tell people to reduce their sodium intakes by adding less salt to their food or even reading those food labels. We needed to get the industry to do something. So the sodium program in the UK, I think, is the first global example of a country telling an industry to do something. And I would say the other thing was the willingness to have really robust conversations with industry, because an awful lot of the reasons for not doing things we have learned over the years are not always 100% correct. So of course, sodium is a preservative, but it's not as much as, but there still is a great scope for sodium reduction. So a degree of skepticism. And one thing I would really encourage others to do is to learn from the UK, learn that there is great scope for sodium reduction. We've had a 40% reduction in our bread, and no one has really noticed that. Huge reductions in our breakfast cereals as well. So, you know, once industry got going, they kept going, providing government kept on nudging them.
Thanks, Alison. So, yeah, healthy skepticism and the mobilization of civil society also vital ingredients. Professor Takemi, I saw you nodding through those interventions.
Yes.
Are there any other ingredients you would add to the mix for a country just starting out?
Yes. I'll talk about the Japanese example. We have a lot of, I'll talk about the manpower to implement salt reduction. So in Japan, we have a lot of many volunteers to implement healthy eating. And they're working voluntarily, actively engaged in community intervention. And another manpower is specialist. We have so many registered dietitian and dietitian, and they are working for private companies, private sectors, and they play an active role in private companies to reduce salt and to make products more healthier. So such a specialist is good role for private and government and academia partnership. They have a good role. Good, I think their role is very maybe effective to make collaboration with some stakeholders.
Thank you, Professor Takemi. Yeah, the importance of using the resources you have and the specialist resource. Now, I'll come back to you later on the interesting public-private academic partnerships that you highlighted in your presentation. Now, I think for the next question, I'll turn first to Dr. Tedstone. As Joy said, and as you've admitted, you've been central to the successful sodium reduction actions in the UK over more than the past decade, which has acted, as Eduardo said, as a pathfinder for some other nations. But if you had to start again in the UK, what do you think you might do differently, having learned from your experience so far?
I think that one of the recent learnings is that the amount of, I mentioned it in my talk, but the amount of food being sold by the industry not only is a really important contributor to total sodium intakes, not just per 100 grams. And I think we would have bought in portion size reduction targets earlier if we had recognized that before. I think we may not, we also, like other countries, have gone down the route of having specific targets for specific foods. That's incredibly burdensome for countries to do that. And I think, so in our later programs, so for example, in our sugar reduction program, we have used much broader targets. So instead of having a target for a chocolate biscuit and a plain biscuit, we now have a biscuit target. And that does actually save quite a lot of burden on civil servants. and some of industry like it, others don't, but on the balance, I think that's the better thing. So, you know, when I hear the US say how many targets they've got, 100 and something, it's a lot. And I think we would be, if we were reinventing it, probably reduce the number of targets and also, as everybody has flagged, bring the out-of-home sector in earlier. We have brought them in. We probably should have brought them in earlier because out-of-home food is an everyday thing. It's not a treat anymore. You're on mute, Steve.
Sorry, I knew I'd do it sooner or later. Some really good tips there about where countries just starting their programs might learn from the experience of the UK, but others I'm sure have experiences to add. So I'll open the floor to the other panelists for anything they would add, anything they might suggest countries do differently from the approaches that they may have heard or read from the countries that already have programs in place. Anyone else want to take up this point?
I like to make a small comment there. So as I presented, our strategies were mainly, whatever we did, were mainly the formal industry, large scale chain of restaurants, maybe local, maybe international food industry. But unfortunately, there's a large informal sector in our part of the world, and we would like to get them more involved if possible.
Thanks. Thank you. Eduardo, over to you.
May I thank you. I think that from our national experience, we learned, of course, there was with a lot of support internationally, but in terms of the national strategies, I think that I wish we had earlier worked with not only with industry, which was the first stakeholder that we got together, but also gathering the advocacy of civil society and the support by academia from the very beginning as a steering group perhaps would be something that will help us. But following the steps that we thought of, knowing the burden of salt consumption, knowing food patterns and building a gradual strategy, but at the same time that all of the multi-components started at once because we would gather them over time. So of course it's gradual, it's sustainable, but in terms of the impact, I think we would have more impact if we did the whole plan at once at the very beginning, even setting the targets, because we set targets over time, like food category by food category. If we had all at once, it would be much more helpful and more impactful.
Thanks, Eduardo. Alison, I see you wanted to come back before we move on. So back to you.
Yes, one thing I would say to other countries is, and I think Chizuru made this point, is that companies, the same company is providing food at different sodium levels, the same food into different countries. And actually, if they can provide a product with a certain amount of sodium into the UK market, there's no reason why they can't supply it into the Sri Lanka market, for example. But those companies will tell you that they can't. And actually, I would encourage countries to look to what's in the market for countries that have had sodium for a long time, like the UK, and to really challenge those global companies that it's not good enough. So there is that point as well. Thank you, Steve.
Thanks, Alison. Time's going on. We have just over 5 minutes left. A couple of really interesting things and innovative approaches I'd now like to get a bit further information on. Turning, I think, first to Professor Takemi, who highlighted the public-private academic partnerships and their importance in Japan, and also the accreditation of reduced salt products and certification in the out-of-home sector being led by third parties, by specialist bodies and organizations, and not certified by government. That's a really interesting take. So, Professor Takemi, why do you think that works so well in Japan?
Yeah, thank you very much. A good question. I would like to answer this question from my personal opinion. because firstly, the ministry is make a standard and such a certification system by the government, but that didn't work well because the opposition from private sectors. Because the main reason is private companies have misunderstood that the government was trying to push the regulation. Here at that time the academic has power that was able to overcome that situation because academia makes decision from a fair standpoint, neutral point, and based on the scientific evidence. People trust academia. So as a result, as such a certification system I mentioned is realized. And then now, the many private sector is support and to this certification system, and they apply to get certification for this. So I think academia and government is a good partnership. To make the certification system in dining out and cafeteria, etc. Yeah.
Thank you. Really good insight to make sure you make best use of trusted partners in your national salt reduction strategies. My penultimate question then, not quite the last, I'd like to ask Eduardo and Vindya, both of whom highlighted the importance within their national settings of multi-component strategies. If they had to recommend just one thing that a country should do when it started, what would that be? So Eduardo, to you first.
Thank you. It's a great question. I think I'd like to stress the importance of the momentum that we have now in terms, especially internationally, a decade of action of nutrition and everything, support between countries. So firstly, the countries know that they're not alone. There's lots of experience around and there's support by other countries, by WHO. There's many materials to support. But looking nationally, I think that firstly, know the sources of sodium, and know how much sodium you consume, know the stakeholders, and build this steering committee, and then you can work along with them along the way and tailor the policies that you need. And so building this multi-components and investing the time in which ones will be most impactful. And of course, evaluating over time. So we have many partners, both nationally, internationally, in terms of universities. And that's going to be very helpful. Like us in Brazil, we had the help of the University of Liverpool and other partners that were very key for us succeeding and moving over time.
Vindya, what would your answer be?
Yeah, so I also agree with what was expressed, and in addition, having an action plan with responsibility, especially given to the health partners as well as non-health partners, is very important. So we can network together and at the same time monitor whether they are carrying out the responsibilities assigned to them. Without having a proper structure or a plan, it's very difficult to coordinate with the health, non-health, as well as mention the academia and the researchers especially. So I think first of all, have a proper action plan and a monitoring mechanism so that you can easily achieve the targets as planned.
Thank you. My final question then for this panel session, and forgive me for mentioning Codex, how could I not give my introduction by Chizuru? So how could Codex then, as the international food standards body, facilitate or support countries' efforts in reduction of sodium intake? I'll throw the floor open. We probably just have time for one answer. So whoever speaks first gets to answer this question. Who'd like to stay on? Who'd like to answer?
Well, it might as well be me then, because nobody else is saying it.
You go, Alison.
Labeling. Good sodium or salt labeling, depending on the jurisdiction, is so important. And for such a universally accepted nutrient of harm, it's not acceptable not to have it.
Brilliant. Thank you. And thanks to you, Alison, to Eduardo, to Vindya, and to Yukari as well. Thanks for the panel discussion, which I now need, unfortunately, to draw to a close. So we can hear from some other partners. So we've heard the important role that industry plays in delivery of salt reduction programs and in their design too. And we have a couple of industry partners with us, and I'd like to see them as partners rather than as bodies that we work against or in adversarially. So maybe they can indicate to us some of the commitments and actions that they are involved in. So first of all, I'd like to call on Dr. Mitsuru Tanaka of WINA to give us some insights from his sector. Dr. Tanaka, are you with us?
Thank you very much. From WINA, I am the head of food safety and security. My name is Tanaka Mitsuru. Thank you very much for this opportunity to speak today. WINA, W-I-N-A, is a World Instant Noodle Association, and we are involved with the various organizations and companies that are working in the area of instant noodles, and we hope that we can elevate the quality so people feel safe in eating the products. This is the area of our activities, and we have 23 regions, 142 member companies that have participated in our activities. Recently, the ESGs, SDGs have become an area of interest, and companies have been exposed to different expectations in terms of social responsibility, and there are various challenges. The first one is regarding GHGs and also various environmental issues. And second is regarding salt reduction and other health and nutritional issues. The consumers have a heightened understanding of health now, and also salt, fat, and sugars are exposed to taxation as well in various countries. And if looking at health and nutrition is a very important topic for a food company as well. WINA is established the Food Safety and Security Organization in 2018 and have deepened our discussions through various opportunities. In 2022, we are planning to have the WINA Valley Summit, and we hope to address sodium reduction targets and commitments to be announced. And with that, we would like to try to contribute to the WHO recommendation of 5 grams per day. And the instant noodle was born many decades ago in Japan, and with the globalization, instant noodles are now loved around the globe with the localization, and there is more than 160 billion meals being enjoyed. And instant noodles can be stored for a long time in normal ambient temperatures, and we believe that it contributes to famine issues or hunger issues as well. So it has enormous potential in various aspects, and improving the nutrition of the instant noodles would have an enormous impact. And when we look at the various culinary cultures. We need to respect them as well as to improve the nutritional aspects as well, and we would like to contribute and promote these aspects. The WHO and Ministry of Health, Labor and Welfare and other ministries and organizations, we hope that we can have more free level of discussion so that we can have staff level deep discussions and build those relationships. Thank you very much for your kind attention.
Thank you very much, Dr. Tanaka. Next, I'd like to pass the floor to Mr. Rocco Rinaldi of IFBA, who can give us further perspectives on the actions and commitments of our industry partners for sodium reduction. Mr. Rinaldi, the floor is yours.
Thank you very much, Steve, and Chizuru for the opportunity to speak to you today. IFBA is an alliance of 12 of the largest international food and beverage companies, and we've been working together on nutrition and health since 2008. Food reformulation and innovation has always been one of the central pieces of our work, and sodium reduction is, of course, an important priority within that agenda. IFBA supports the WHO dietary recommendation of maximum 5 grams of salt intake per day, and IFBA have been working towards this objective with, we estimate, an average salt reduction of around 27% across our company's portfolios since the 2025 target was set. Labeling of sodium or salt content is also part of our global commitment on consumer information, both on back of pack and on front of pack where possible as a percentage of recommended daily intake. Now, we have, of course, more to do, and today we are launching here at the Tokyo Nutrition for Growth Summit the next step in this journey. The IFBA Global Sodium Reduction Commitment, which we are announcing today, will set common global targets for maximum sodium content across some 40 food categories, which each IFBA member company will need to meet. There will be 2 sets of targets, one for 2025 and one for 2030. The 2030 targets will be revisited already in 2025. This is the first ever collective commitment by the food industry to implement globally set standardized targets for sodium reduction in manufactured foods. Now, these targets are going to work independently of national or regional target setting, as well as individual company targets, which may go beyond this minimum global IFBA standard. The WHO Global Sodium Reduction Benchmarks provided a very useful reference and guide for us as we developed our targets, alongside several national sodium reduction targets, of which we have heard some good examples here this morning. Now, our ambition is to keep progressing on this journey of sodium reduction towards the WHO benchmarks wherever possible. Sodium reduction is necessarily a gradual effort, as we do need to take the consumer palate with us. But counterintuitively, we can actually move faster if we move together. It is no secret that the absence of a level playing field makes it more difficult for any one company or group to go further or faster. And so we need critical mass within any one market or country to be committed to sodium reduction. The out-of-home and hospitality sectors are really important players here, alongside the prepackaged food sector. Global benchmarks and targets are helpful, but it is at the end of the day at country level that we will make the most progress towards the 5 gram a day target. And that is why we welcome government-led initiatives to bring all food system players around the table for concerted national sodium reduction efforts. We've heard a number of excellent examples today of how such national initiatives can be successful. Dr. Tedstone expressed, I think, a positive surprise after some time how the collaborative effort with industry worked. I think that is largely down to the intelligent way in which that program was established, run, and developed over time. Now, we look forward to continuing this journey, and we call on all relevant actors to join the effort. Thank you very much.
Thank you, Mr. Rinaldi, and my thanks to IFBA for choosing this summit for the launch of your global sodium reduction commitment. So I now need to draw this part of the proceedings to a close. My thanks to all the panel discussion participants and to our contributions from industry partners. And I'll pass now back to Chizuru. Chizuru, back to you.
Thank you very much, Steve. We have now come to the end of the session. We do apologize for the overrun, but thank you very much to all our speakers and panelists and all the participants for being with us. We heard various country experiences and then learned different innovative efforts and actions which different countries are taking to achieve sodium reduction. There have been a very long journey for many countries, but as we heard, they are seeing the fruit of all the efforts they have made. We also heard just now the very encouraging commitments of two big private sector association and alliance to make further efforts to improve the food reformulation through further reducing sodium content in different food categories, which are contributing to increasing sodium intake. We very much hope what was addressed and learned from various country experiences at this side event would inspire countries and national governments which have not yet started to make commitment to accelerate actions in reducing population sodium intake. Now, I would very much like to introduce Dr. Francesco Branca, our Director of the Department of Nutrition and Food Safety in WHO, who would deliver the closing remarks for this side event. Francesco, the floor is yours.
Chizuru, and let me join Chizuru in thanking you all for being with us today, particularly the speakers, particularly those who were up in the middle of the night. Clearly, what we've learned today is that sodium reduction programs initiated over 2 decades ago in some countries. But now what we're seeing is that this is a practice that has been established in many countries. We've heard about 100 countries who are doing that. It's still not all the countries of the world, but it's, of course, major progress. We've heard some success stories from Japan, UK, USA, Brazil, Sri Lanka. And we've heard that we need a combination of upstream and downstream strategies. So basically, we need to see the offer of food change. We need to see food environment with less products containing high amounts of sodium. And we need downstream strategies. We need people to go along with it. We need people to make the right choices and also adopt the right behavior. It is a combination of regulatory and voluntary. And I also would like to welcome the important commitment that has been done by the International Food Beverage Alliance on sodium reduction. It's been an interesting conversation with them in these years, and we look forward to the implementation of this commitment. And it's interesting also to engage with other private sector, and definitely the Instant Noodle Association is going to be an important player in this sodium reduction journey. What's the impact? The impact, let's be frank, has been moderate. We've seen reduction of perhaps 1 to 2 grams, which is a lot, saves a lot of lives, but not enough. What we want to see is reduction in the order of 5 grams or even more in some countries. So what is what's next? I think we have heard that there are a lot of new promising approaches. Certainly, the offer of food in public institutions or the public food procurement is an important way forward because of the power of the public authorities to purchase foods. We've heard about interesting developments on the offer of food out of home and having the caterers also contributing to this journey is going to be quite important. We've heard about the potential to use alternative to sodium, and high potassium, low sodium substitute is potentially a way forward. But it's an important public health engagement. We're very happy that this is happening at the same time of a Nutrition for Growth Summit, which is bringing incredible contributions to the nutrition policy and the opportunities for the implementation of those policies all around the world. So looking forward working with you in the years to come on this important public health agenda. Thank you again.
Thank you very much, Francesco. So now we are at the end of the session, but I thank you very much again for everybody who joined us at this side event. Thank you.